There can be a lot of confusion between this. Open and closed is basically about where the incision is made. Closed usually means all the incisions are made inside the nose. Open, the incision is made on the outside. Key is that this is an incision. It's not an operation. It is an incision to approach how you're going to do your rhinoplasty. Unfortunately, for some surgeons or some practices, the approach is always the same. They may always approach everything with an open, always with a closed. The advantage of a closed is clearly the incision, but also the way that the surgery is undertaken, the trauma to the skin and the tissue is minimized. With an open approach, you always tend to incise some of the blood supply, you affect the blood supply and the nerve supply. It's a little bit more invasive. It has a long healing process, a little bit more traumatic for the nose, but undoubtedly can achieve a lot more change. So the bottom key difference between open and closed is really it's an approach, and the key difference is that you've got to tailor the procedure to what the patient requires. Open versus closed is the same thing. So the kind of average journey of a patient post-surgery is surgery is usually done as a day case. On 100% of our procedures are done as a day case, and that's clearly a product of having the right anesthetic techniques for good recovery and non-traumatic surgical approaches, so the patient is in a good enough position to be able to go home. The first 24 hours you will get the effect of the anesthesia, so usually pain is not a significant issue in the first 24 hours, just the drowsiness, the sleepiness associated with having had the anesthetic. 24 hours, that's out of the system. Nausea, vomiting is rare with rhinoplasty surgery, especially with the kind of anesthetic techniques we use. Subsequently is the healing process from any kind of nasal procedure, and that doesn't matter whether you're having a rhinoplasty or other types of nasal or sinus procedures. Patients tend to go through a very similar process. So day 1, 2 tends not to be too bad. Day 2 to day 6 tends to be where you somewhat hit a little bit of a slump. Here, emotionally, physically, you feel drained. All the energy, the adrenaline runs out of the system, and the inflammation kicks in from the surgery. So usually you feel a little bit drained, you feel a bit tired, you feel your sleep quality gets affected. It feels usually sore. Pain is not a major feature of rhinoplasty surgery. It's usually a soreness, feels a little bit raw, uncomfortable. Paracetamol, brufen is more than adequate. Sometimes you need to take something a little bit stronger to help you with that period. Usually by day 6 you come out of the slump and you start feeling a lot better in yourself, and you start mobilizing and you feel more yourself really. Bruising wise, with the kind of techniques we use, they're usually minimum. You're likely not to see much in the first 24 hours, may start getting it the next morning, progresses a little bit over the first 2 to 3 days, and then progressively gets lesser and lesser towards day 6 and 7. So usually by day 7 you have gone through the early post-operative period and the recovery. Overall, as you're all aware, the long-term recovery from rhinoplasty, or how the nose settles, takes a year, 18 months to do so. But this is the immediate effect that you will have from the anesthetic and the post-operative recovery. My recommendation is always to have 2 weeks of work or activities for the post-rhinoplasty surgery. The reason for that is the first week is usually post-operative anesthesia, soreness, general recovery that you will get from any kind of operative procedure. Subsequently, it really takes another week for your body to have really acclimatized and got back to functionality that you need to take to work. In the early period, it's much more valuable to get that rest than to actually dive in too early into activities and find yourself struggling and then delaying the whole recovery process. So I would strongly recommend take 2 weeks off and use that effectively to be able to get back into your normal practice. Subsequently, the next target is usually 4 weeks. So when it comes to when can I get back to physical activity, going to the gym, I would suggest 4 weeks. When can you go traveling overseas, especially if you're talking about air travel, I would say 4 weeks. So 4 weeks is where you can get back into other forms of normal activity, wearing your spectacles, going swimming. 4 weeks is the usual barrier at that point. In the long term, you just got to be protective of your nose. Obviously, you cannot undertake any contact sports afterwards, and you need to protect the nose from really intense sunlight, because with rhinoplasty surgery, the skin can become vulnerable to damage with sunlight. So in the long term, you just need sunlight protection, and obviously no protection against any trauma to the nose till the nose is completely settled. Come about a year, the nose is really as normal as it's going to be. It's going to be fully mobile, it's going to feel normal, the sensation is returned, mobility is normal, and aesthetically it should be completely settled. Image morphing and simulation of rhinoplasty is really current practice. If the surgeon is unable to indicate to you what kind of change you are likely to get, then you're going on a blind journey. So morphing is a really useful tool for understanding and communication. For me, in rhinoplasty, there are three factors. One is clear understanding of what are the aspirations, what is the patient, the client really trying to achieve, what really disturbs them. Second is, can I surgically deliver that? And thirdly, can I make the individual and the client understand where that journey is going to take them, such that both themselves and myself are going to be happy at the end of that journey. This is where the morphing really is extremely helpful, because most clients come to the clinic fairly well informed, having looked at the internet and different types of results. And the commonest procedure, for instance, is a hump reduction, a reduction in the height of the bridge of the nose. You go on the internet and you'll see multiple different types of outcomes for a similar kind of deformity. Now, the key factor is that the client may think that that particular kind of nose looks beautiful on the internet on a different face, and they perceive that that may be the right outcome for them. The morphing allows me to explore the kind of changes that can be realistically made to their nose, what it will look like, and how sometimes what the aspirations may be inaccurate or inappropriate for their facial features. And that allows a two-way journey for us to be able to discuss the types of changes we're making from planning to make from the surgery, so that that end point for the journey for the individual is fairly clear. Obviously, this is image morphing. It doesn't equate to real results, but the key factor is that sensible, ethical surgeons will probably present to you realistic outcomes from their surgery, such that you have a conception of what the real result's going to be. So to me, morphing is an extremely valuable tool, both for me to make sure that you understand where this journey is going to take you, and for you to have clarity about what kind of changes will happen and what does it look on your face. The other aspect that's sometimes very valuable is that often the predominant deformity, say a large hump, dominates your eye, and that's what you're concerned about. But when I look at your nose and I can identify other little factors, such as the turn of the nose, the definition of the tip, which will become more obvious once you've taken the obvious deformity out, it allows you to see how changing the first aspect will actually affect the shape of the nose and how it appears. So it really is a valuable tool for you to understand what rhinoplasty can achieve for you, and for me to be sure that where that journey is going to take you is where you'd like to go.